Hello there, I'm Shira Abang Mansoor. You are now watching English News at 5. Bintulu MP Datuk Sri Tiong Sing questioned the absence of Health General Tan Sri Dr. Noorhisham Abdullah on field, which led to an outburst in the Dewan Rakyat yesterday. While debating the supply bill yesterday, Tiong said that the Director General was afraid of dying as he did not go out into the field to experience firsthand the current situation of the pandemic.
Ini TG hari-hari buat berita saja. Fikir apa? Kalau kita itu berita, pagi itu office boy dia pun boleh pecah. Kenapa? Dia tidak turun padang. Macam KK sekarang, Sabah. Begitu teruk, begitu hebat itu pandemik COVID-19. Kenapa dia tidak turun melawat tiap-tiap hospital? Temporary hospital. Kita pergi tengok, berbincang kasih moral support itu frontliner juga. Doktor, jurulawat, tiada semua bekerja sana. Jangan hantar saja doktor pergi, jurulawat pergi. Oh, itu orang tak takut mati, tapi DG takut mati. Timbalan DG pun tak pergi. Apa sudah jadi? Tak usahlah hari-hari nak buat publicity.
Dulu. Boleh minta.
I tengah dia sekarang mau projek dia sendiri cari WHO punya setiausaha.
Tiong noted that the Health Director General should be in the field to give moral support to the frontliners.
DG is a frontliner.
Saya minta masa tambah.
Ya Bumat
Tapi
bagi.
jangan kong kali kong lah. Bintulu kong kali kong.
Kita mau tengok.
Tiong's statement has caused RSN Raya, PH Jelutong, to ask the Dewan Rakyat Deputy Speaker Datuk Sri Azalina Othman said to stop Tiong from attacking the Health DG and wants the statement to be withdrawn.
Meanwhile, Dr. Noorhisham responded that no issues of fear of death in performing duty to curb the chain of COVID-19 in Malaysia. This was said in response to the allegation made towards him by a parliamentary member for not going on the ground field in Sabah. He said the Ministry of Health has a special plan for Sabah and revealed that he himself has visited Sabah at the end of August to see the management and preparation of his ministry.
Di Kementerian Kesihatan, kita telah pun membuat perancangan yang khusus untuk negeri Sabah. Dan saya sendiri telah pun turun ke Padang, iaitu pada pengakhiran bulan Ogos dan melihat kepada pengurusan iaitu kesiapsiagaan kita untuk kita melihat kepada pilihan raya negeri Sabah dan juga saya telah arahkan timbalan saya Datuk Dr. Chong Chi Kiong untuk turun bersama iaitu minggu lepas. Dan Tan Sri Jamilah pun telah pun turun bersama iaitu 2 minggu lepas untuk melihat kepada tindakan-tindakan kita iaitu pengurusan COVID-19 dan isu-isu yang timbul di negeri Sabah.
Dr. Noorhisham added what is most important is the good intention in performing the duties and efforts in cutting the chain of the virus.
Meanwhile, Bintulu MP Datuk Sri Tiong Sing today defended himself over his controversial remarks in Parliament yesterday about Health Director General Tan Sri Dr. Noorhisham. He said in a statement that he was not being malicious and merely wanted to push for a more hands-on approach in tackling COVID-19 pandemic.
Tiong, who is Progressive Democratic Party president, said he did not intend to maliciously target Dr. Noorhisham. He added that DAP MPs for Jelutong, MP, RSN Raya should not take advantage of his words for cheap publicity in the alleged guise of defending civil servants. He said, quote, "My words reflect the frustrations of the frontliners and the people for the past several months," unquote. In Tiong's statement in Facebook, he reiterated that his statement in the Dewan Rakyat was not meant to be malicious, rather acknowledging that civil servants do not have it easy and are working hard for the country, but argued that any shortcomings must be identified and improved. Meanwhile, claiming that the COVID-19 situation is getting out of control, Tiong also alleged that there have been human errors in decisions made over the prevention and control of the pandemic. Tiong said the affected areas in Sabah should have been cordoned off with immediate mass screenings once COVID-19 clusters have been identified as early as October. He suggested that parts of the government's allocation worth billions of ringgits to fight the COVID-19 pandemic could have been used for large-scale COVID-19 tests.
Tupong Assemblyman Fazruddin Abdul Rahman supported the proposal to create Jobs Sarawak as an online job search platform tailored to advertise vacancies in Sarawak.
According to Fazruddin, the Jobs Sarawak platform will play the same role as the existing long-term platform, which is Jobs Malaysia. However, the only thing that differs these two platforms is that the job searchers in the state do not need to go through nationwide occupational opportunity in the search process.
This can narrow down the opportunities available in Sarawak, focusing to Sarawakian rather than the Sarawakian applicants going through the job opportunities throughout Malaysia. Furthermore, this will also assist to ensure that the requirement for companies residing in Sarawak to advertise their vacancy in Jobs Sarawak first before opening it up to non-Sarawakian or non-Malaysian.
He said this when presenting his debate on the Supply Bill 2021-2020 and the motion to refer to the Development Budget Resolutions for Expenditure 2021 at the State Legislative Assembly sitting on Wednesday. Fazruddin also recommends a special committee formed to review and monitor the symptoms of online gambling, as well as enacting stricter legislations to overcome the problems.
Jadi saya menyeru agar satu jawatan kuasa khas dibentuk untuk mengkaji dan melihat secara serius masalah ini dan menggubal undang-undang yang lebih ketat lagi bagi mengatasi masalah ini. Ianya merupakan masalah yang begitu serius sekali dan memerlukan tindakan dan perhatian yang lebih tegas daripada kerajaan.
Welcome back. The Sarawak government is rigorously undergoing negotiations to review the implementation of Malaysia Agreement 1963 MA63 with the federal government through various committees. Assistant Minister in the Chief Minister's Office, Law, State Federal Relations and Project Monitoring of Sarawak, Datuk Sharifah Hasidah Said Aman Ghazali, has revealed of the 13 claims forwarded, 5 of them have been successfully agreed to.
Kerajaan negeri telah mengemukakan 13 tuntutan kepada Kerajaan Persekutuan. Daripada 13 tuntutan tersebut, 5 tuntutan telah berjaya mendapat persetujuan bersama antara Kerajaan Negeri dan Kerajaan Persekutuan. 4 tuntutan lagi masih di peringkat rundingan, manakala 4 tuntutan lagi dibincangkan di bawah jawatan kuasa bersama yang telah ditubuhkan bagi perkara-perkara berkenaan.
She said this in reply to a question by Jamoreng Assemblyman Dr. Juanda Jaya, who wanted to know the latest updates on MA63 negotiations during the State Legislative Assembly meeting this morning. Hasidah added the first claim referred to a review of special allocations for Sarawak as enshrined in Article 11D of the Federal Constitution. As for the third claim, the federal government has agreed to implement a transfer of power from a federal minister to the state authorities in order to enact subsidiary laws under the Sarawak Labour Ordinance concerning labour that are suitable for implementation in Sarawak.
If Pfizer Incorporation submits the positive initial data from its COVID-19 vaccine trial to health regulators as quickly as expected, the US government plans to begin vaccinating Americans in December. The US drug maker said it expects to have safety data as soon as next week, but it needs to apply for emergency use authorization, EUA, with the US Food and Drug Administration.
Pfizer on Monday said the vaccine it has been developing with German partner BioNTech was 90% effective against COVID-19 based on an early look at results from its large late-stage trial. Upon FDA authorization, the United States would receive about 20 million doses of the Pfizer vaccine per month. Besides that, HHS could be procuring supplies at the end of this month. The United States has a $1.95 billion contract for 100 million doses of the Pfizer vaccine, enough to inoculate 50 million people with an option to acquire 500 million more. Based on the recommendations to the government, it will likely start with inoculations of the elderly in nursing homes and assisted living facilities, healthcare workers and first responders, with a goal to complete those shots by the end of January. Top US infectious disease expert Anthony Fauci also said that he expects the doses of the vaccine to be available for certain high-priority groups in December.
Torrential rains from Typhoon Vamco lashed provinces in the Philippines' main Luzon island, killing at least one person and paralyzing parts of the capital Manila as some residents awaited rescue by boat due to rising floodwaters.
Vamco, the 21st cyclone to hit the Philippines this year, battered the nation still reeling from Gone, the world's most powerful typhoon this year that killed 25 people and destroyed thousands of homes early in November. The latest typhoon, which has left 3 missing in the coastal province, comes as the Southeast Asian country is still grappling with a wave of COVID-19 infections and a battered economy. In some suburbs east of Manila, residents took refuge on top of their flooded homes. In parts of Manila, people waded through waist-high floods, carrying valuables and pets, while rescue workers ferried residents around in boats. Flights and mass transit in Manila were suspended while the Coast Guard stopped port operations. Government work was suspended and financial markets were shut. Vamco has now weakened with sustained wind of 130 km per hour and gusts of up to 215 km per hour as it moves across Luzon, home to half of the Philippines' 108 million people. Vamco is forecast to head towards Vietnam. Floods and mudslides over the past month have killed at least 160 people in central Vietnam, left dozens missing and damaged 390,000 houses.
Right. Next English news will be at 11:30 p.m. Nightline with Ruben Gomez. I'm Shira Mansur. Thank you for watching.